There are 5 core needs that we're looking at: interpersonal violence, transportation, housing instability, food insecurity, and utility assistance. I think increasingly there's more recognition that what we call the social determinants of health are major drivers of people's health status and their health outcomes. And so the exciting thing about this project is that we can try to address these kinds of social needs and really have an impact on people's patterns of healthcare utilization. So if we can provide people with assistance getting a stable access to food, we'll be able to help them in their daily life and functioning without having to seek formal medical care for things that community agencies actually have very good, solid ways of addressing.
We want to look at what already exists and in the community, what's the type of the collaboration or the coalition already there, and so either we can be part of it, and or we can collaborate with them and to identify some common ground. So in that way, we don't want to reinvent the wheel. We don't want to have a duplicative services. So that's more from the community level. So regarding the person level, quite often and the people when they are sick and all they care about is how to get well and how to get back to their normal life. And so they already stressed. And so there needs to have someone help them to navigate the system. And in the current practice, we tell patients, this is what you need to do. And we give them a piece of paper. However, how to do that and how to communicate with the community organization and what's the benefit, what's the services they should and they can and access to. And sometimes it's quite challenging and to the people. So in our project, and we try to have this navigator understand them, understand their background, understand their social support. So in that way, we will develop a more personalized action plan for them. And then we will follow up with them and help them to go through this process.
We chose these counties in Appalachia and also these specific areas in Jefferson County. There are longstanding issues with chronic diseases, so obesity and diabetes, cancer. It's generally the health burden is fairly high in terms of chronic diseases, smoking, tobacco use, things that affect your health in different ways. And social factors affect a lot of those what are personal health conditions, but they're affected by the neighborhood where you live, the community where you are. We will screen over the course of the 5 years hundreds of thousands of patients. We'll be able to provide a tailored navigation service for them to connect them to services for the need. And then long term, of course, the goal is to evaluate impact on their health outcomes. Did we reduce unnecessary healthcare use and costs by attending to people's social needs?
Our goal is to establish a strong group of clinical and community level partners, and along with other stakeholders, which include the local government, community-based organization, and also the Medicaid. And so in that way, we will establish a community advisory board. And we also want to facilitate more structured communication among those stakeholders.
We have health departments, we have local government, we have housing organizations, health collaboratives, payers. We have all kinds of folks at the table. And I think this advisory board mechanism is really going to help bring their different perspectives together and give us a product that actually could be sustainable in these communities. That's really what we're working for. We want to have a sustainable effort so that after the dollars from CMS are gone, the alignment work has been done so that we can have these seamless referral processes for patients.
Our goal is to not just look at what works, and also want to understand why and how it works.
We're looking at costs, we're looking at healthcare utilization, but I think we really have potential to actually make an impact on patients, vulnerable patients' health status, so that their quality of life improves and they're living a life that they want to live.